Good afternoon. This is Dr. Do again. Video is quarantine special edition, video number 15. Today I'm going to talk about the lymphadenopathy. Could be inflammatory or could be not. But I'm just going to talk about the lymph node, especially swelling lymph node. Why? Because we talked about immune system last time, about the test, and I just want to extend from there. Lymphatic system, we talk about the organs, spleen, lymph node, and blood lymphocytes. So lymph node is belongs to the lymphatic system. Lymph node is where the lymphocytes, the immune cells, produced. Last time we talked about B cells, T cells, and especially T cells definitely is where mature and produce from the lymph nodes and circulating the blood, and the lymphocytes, different kind of lymphocytes circulating the blood to defense, to immune, protect ourselves, protect our body. Lymphadenopathy could be painful or non-painful swelling of lymph node. Usually where to look for those lymph nodes? Under the chin, and along the center, along the trachea, and clavicle, above or beneath the clavicle, and the armpit, whether the lymph, especially for female, the lymph node in the armpit, and the groin area. So these are the lymph nodes for you. This is the special time. You can check it regularly, especially for elderly female. What kind of problem you need to see the emergency for the lymph node? In general, lymphadenopathy itself doesn't warrant an emergency visit, unless two problems. One is along the trachea center. If you have lymph node growing bigger here to press the trachea, impaired breathing. That is the one of the category you need to see emergency to make sure your trachea is still open. Either surgery to take it out or do the intubate to keep the trachea open. The other category actually is not lymph node swelling itself, but lymph node, lymphadenopathy or lymphadenitis. The swelling, painful lymph node associated with the upper respiratory infection, and that infection causes the swelling of your trachea or epiglottitis, impaired breathing. Again, this is not because of the lymphadenopathy, but it's because the disease associated with this causes you difficult breathing. And if that's the problem, you need to see the emergency room. Other than that, I couldn't think of anything special that you need to see the emergency room for the lymphadenopathy or lymphadenitis. Okay, what's the difference? They all belong to the lymphadenopathy. One is painful, inflammation. The other is non-painful, not caused by inflammation. Okay, so what kind of danger sign for the lymphadenopathy? We actually basically is the non-painful lymph node. If you feel it, especially if it's growing fast, very fast, or it feels hard. Sometimes we all have those kinds of non-tender lymph nodes. If you feel soft, it's easy to move. For example, I have it right now, but it's not painful, but it's probably fighting the infection, starting infection. I did not notice. This is the lymph node, the function of lymph node. So the swelling lymph node doesn't mean it's bad, but this is the situation I just mentioned. If you have lymphadenopathy, lymph node growing really fast, hard, and the shape is not regular, and it cannot move, it's not smooth, it's not movable, especially for the older people, that's a sign. It's bad. Something might be very serious, wide metastasis, tumor, cancer, metastasis, that's one of the major causes. That's why I said it's dangerous. So during this quarantine time, you can feel your lymph node either around the clavicle or under your chin, mandibular lymph node, and make sure just regularly check it. So you're the one alerted. Be alerted first, and then if something like I mentioned, go to check with your physician. The sooner the better. Okay. In terms of lymphadenitis, usually associated with the infection, which is not a bad thing because, as I said, lymph node produce lymphocytes. The function of lymph node is to fight infection. So if when you have fever or without fever, when you have the nasal congestion or coughing, these kind of symptoms associated with either viral or bacterial infection, you have the lymph node enlarged, tender. It is normal. It is okay. You don't need to worry about it. But you need to see a physician if you feel very sick, the fever associated with very, in general, not feeling well, feel very ill, so that you need to see a physician, possible bacterial infection. Again, this is not included, not considered during this pandemic of coronavirus outbreak. Regardless of what, if you have lymph node swelling, painful, non-painful, coughing, runny nose, fever, non-fever, go check it out. Make sure you're not infected, because this is not just for yourself and for your families, for your neighbors, for the one you love. So that's different. I'm just talking about in general how to handle it, but with exception for this special period of time, regardless of fever, non-fever, you feel very ill, not feel very ill, you have fever, coughing, nasal congestion, lymph node swelling, painful, check it out, okay, for the testing whether it's positive or negative. All right, the other lymph node related topic is for the female. Again, it's not young, for the older. It could happen in young people, but I'm talking about the older female, 65 years old or 55 years old, or you have family history of breast cancer. The self-breast exam is not recommended, but if you have time, you check your lymph node under the arm regularly, particularly if you are diagnosed as a breast cancer, treated, and more follow-up exam, make sure no cancer cells there. But still, it's a good idea to monitor yourself on the arm, see whether there's some lymph node growing, and especially sometimes it is, like I said, it was treated before and now it's coming back, because your breast was already not there for those people especially. So the lymph node, the swelling is another sign to check it out. So this is the very short brief about the lymphadenopathy, because I think during this special period of time, quarantine time, regardless of what kind of cause, if you have lymphadenitis, means painful lymph node swelling, congestion, coughing, go check it out to test the coronavirus, whether it's positive or negative, but check out. So this is the video for quarantine special, and thank you for watching. I'll see you next time.